Hi, Dr. Mark Agresti. I wanted to do this video on adolescent depression because adolescent depression is much different than adult depression. My practice, by and large, is mostly young people, people aged 10 to 30, falling in a lot of the 10 to 20 range. What happens when an adult gets depressed? That's pretty apparent: sad, hopeless, fatigue, can't sleep, guilt, hopeless, helpless, worthless, thoughts of death, dying, can't concentrate, difficulty getting out of bed, difficulty following through, they don't enjoy anything. So adults fit the classic definition of depression, but that's not true with children, adolescents. Now, I've given lectures, and people say, well, that's what I'm about to talk about. That's just normal adolescence. They act like that. It's a matter of degree. So the symptoms of adolescent depression are a matter of degree. Adolescents themselves may exhibit a lot of what I'm about to talk about, but what I want to stress is it's a much more severe degree in depression. I'll explain more what I mean by that. For example, when an adolescent gets depressed, it's not what you'd think like an adult. They become loud, screaming, irrational, bizarre. They become scary, frighteningly scary. They become a danger to themselves and others. They can become assaultive, disruptive, but it's dramatic. Breaking down doors, driving cars, into the hedges, making bizarre threats, becoming very provocative. Now you could say, well, that's normal adolescence, but it's a much more severe degree. Normal adolescence, there's an irrational, loud, screaming component, but this becomes frightening. Let's call it frightening, where they're so irrational and loud and screaming that it's almost terrifying. You think to yourself, I can't live like this. That's more indicative of depression. One of the key features here, anger. When an adolescent becomes depressed, they're very angry, very belligerent. They just ooze. You can't even say, what would you like for lunch? Don't tell me if I want to eat lunch. Why do you have to ask me if I want anything? I don't want to talk to you. Or it's time for dinner. I'm not ready for dinner. Don't, screaming. I said, simple requests like, you need to clean your room. Don't tell me what to do. I'm not going to clean my room. But they just go on these rants that are just beyond the scope of normal adolescent behavior. It is an extreme symptom. Anyone who's lived through it will have an understanding of how severe it is, what I'm talking about. The next component would be oppositional behavior. And when I say oppositional behavior, you need to brush your teeth. No. They'll scream. You need to go to school. No. You need to shower and clean your room. No. Stop eating crap. Everything's a problem. There's not one thing. You can't even look at them. They become such an extreme form of oppositional behavior. Here's a bizarre one. They can, for a long period of time, they can be normal around their friends. It boggles my mind. The behavior at home with their parents and their brother and sister becomes totally inappropriate. But they seem to maintain some normality around their friends until the very end when they withdraw. That's a sign where, that's usually an ominous sign where maybe they're actually thinking about suicide. Here's another aspect of adolescent depression. They talk about suicide, but they start acting on it, cutting themselves, taking overdoses, becoming very reckless with their safety. They become very self-destructive. It's a key sign. A lot of adolescents, I feel like killing myself. But when they start cutting themselves, start taking overdoses, it's much more indicative of depression. So these are symptoms of adolescence, which are normal, but much more extreme. Here's another cluster of symptoms. They have a disregard for their well-being, their hygiene, their dress. They're reckless with things of value like their home, their car, their clothes. Nothing takes on value. And it's much more extreme than normal adolescence. They become much more impulsive. Like to extreme, like some adolescents during their developmental phase become impulsive with drugs, sex, their safety, but an adolescent who's depressed will take it to the extreme where you think they may not live through it. Here's another component. They can be very physically active, not like a traditional adult who'll just sit there and stare at the wall. They can become active, but they tend to withdraw from activities, organized activities, band, sports, debate team, rocketry club, chess team. Their interest in rebuilding cars, or their interest in lacrosse, a music band, it will wane. And they'll still be active in doing things, but they'll withdraw from organized activities which require discipline, attention, concentration, cheer, travel soccer, travel basketball, baseball leagues, Pop Warner football. These are examples of patients who've been here this week. One lost interest in her flute. She was playing in a musical group for the school. So the gist of it is, it's an extreme form of adolescent behavior that's very extreme. And the expression of depression in adolescence is nothing like adults. It's radically different. It's an activated, energized, dramatic, loud, oppositional, defiant, angry, explosive, self-destructive person who literally destroys themselves and everything around them. It's much different than an adult who sits there, withdraws, sad, hopeless, fatigued, can't concentrate, lies in the bed all the time, doesn't enjoy anything. It's different. I hope that helped. Dr. Mark Agresti, thank you.